You're going to physical therapy every week. You're doing step-ups, lunges, squats, but your surgical quad still feels weak and almost disconnected. The problem? Your body has secretly learned how to cheat, and most physical therapists don't know what to look for. In this video, I'm breaking down the most common compensations that happen after ACL surgery and how they could be the reason why your strength progress has completely stalled. After ACL surgery, your body is going to do whatever it can to take stress off of your surgical knee and your surgical quad in an attempt to protect itself. If left unaddressed, these compensations will cause quad and knee weakness that will persist for months, even years, leaving you frustrated and stuck. One of my recently new clients came to me 10 months after surgery, dealing with knee pain and weakness, leading to issues with running, squatting, and going downstairs. And she was confused. She was doing step-ups, she was doing lunges, she was doing leg presses, squats, which are all good exercises. But just because someone is performing them doesn't mean that they are actually getting their surgical quad stronger. Let's go through a real example so you know exactly what to look for. Okay, so here we have everyone's favorite exercise, the Bulgarian split squat. Definitely a bit of a love-hate relationship for a lot of people with these, but hey, they can be a very effective exercise in someone's ACL recovery. Now, a lot of these principles I'm going to cover also apply to other exercises like squats, leg presses, step-ups, right? But all split squats, lunges, squats, right, are not created equal. There's many different ways to perform them, and also different ways your body will compensate if not coached correctly. So as I play this video here, we see 3 very different ways this exercise can be performed. So let's break down each one by one. This first variation is a very common compensation after ACL surgery, where the form might look good to the untrained eye, but there's a few important things happening here. Now, in this example, we're going to assume that the front leg is the surgical leg because this is when these compensations will occur. Okay, so as we take a closer look here, if I drew a vertical line from the front of my kneecap straight down to the floor, right? My knees do not travel past my toes in this example here, right? Now, if I also drew a line noting my shin angle, right? So basically this red arrow that you see here along my shin, this line is relatively vertical or up and down. Yeah, it's inclined forward a little bit, but you'll see in the next couple examples where, relatively speaking, this is more of what we call a vertical shin angle, right? So in order to load the quad effectively, we actually want the opposite to happen. We want the knees to be traveling forward over the toes, or even past the toes, and we want the shin angle to be pointed forwards or angled forwards. We call that a positive shin angle. Now, let's look closely again at what's happening here. A lot of my weight, if you look at this still image, is actually being placed on the rear leg. You can see my knee is in a ton of bend here, or knee flexion in this back position here. My knee is really bent up here, and a lot of my weight is actually shifted towards my back leg, taking stress off of my front leg or my surgical leg, right? So as you can see, as I sink down into this movement in this bottom position here, my body is shifting backwards, right? So these compensations are also common when someone places their surgical leg too far forwards, which I'm going to cover in the next couple of examples here. But this is a very common example where we're asking the back leg to do a lot of the work because it's going to compensate and take stress off of the front leg. So the next compensation that could happen is using the hip muscles at the expense of using your quads. So in this example, we see my knee actually does travel forward a bit over my toes here, right? More than the last variation for sure. And you can see that my shin is inclined forward. So to the untrained eye, this could seem like quote unquote like good form, right? But remember, our goal is to strengthen the quad muscles and build up the capacity of the front of your knee after ACL surgery. The knee angle doesn't tell the whole story. If you check out my trunk position here, my trunk is leaning far forwards, which is going to shift a lot of stress to my hip muscles. So if we take a look at the still shot on this variation, this is going to be more of a hip dominant Bulgarian split squat or split squat position, right? So again, looking here, if I drew that same vertical line from my front of my knee down, my knee is well past my toes. So that's a good plus indicating that, hey, maybe we're loading the quads a little bit more than the previous variation. We also see my shin angle, as noted by this bottom arrow here, is pretty far forward, right? It's less up and down. It's more angled forward, right? We have a more positive shin angle that we'll call it here. But again, that doesn't tell the whole story. As you can see, my trunk angle, if I drew a line from my hip kind of straight through my torso here, going up towards my shoulders, I'm very pitch forward, right? And this pitching forward is going to make sure that my body is using my hips a little bit more than my knee, right? And that's not to say that the knee isn't working here. In all these examples, the front knee is doing work. But it's important to note that these compensations will happen and they are sneaky. So, in this example, my body is using the hip here. So we have to be mindful of what is going on, not only at the knee and the shin and the foot, but also at the trunk. So this is more of a hip dominant compensation here. Now, this compensation, while in this, I'm exaggerating this for purposes of this video, right? So you can really see what's going on. It might not always look this obvious, right? So there's going to be varying degrees based on people's, leg lengths, torso lengths, things like that. But as a rule of thumb, we can see that if the torso is really, really pitched forward, you can probably assume that there's going to be a little bit more stress being placed here at the hip. So this can happen on varying degrees. So again, you just want to be mindful that this example is a little bit more of an extreme example to illustrate a point. Moving on to our next example here. So let's play this one and see what's going on. So again, to the untrained eye, this might look like really good form for a Bulgarian split squat, right? But there's a couple things that are happening here that I definitely want to illustrate, right? Super, super important here. So let's freeze frame it and take a look at what's going on. So what's happening here, we're getting a little bit more equal load sharing between the front and the back legs. And this is going to happen when we take a stance that's a little bit too wide or too far apart, we'll call it, right? So basically this front leg is going to be, well forward of the bench here. And what's happening here, right? If we just kind of break down like the way we've been doing it, again, we can see relatively, vertical-ish shin angle, but we are pointed forward a bit. My knee doesn't really travel past my toes here, so that's, something else that we're going to look for that's not ideal for loading the quad, right? But we can also say, oh, hey, your trunk is pretty vertical, right? It's not really folded forward, it's upright, so we must be loading the quad a little bit more. But here's the problem, right? We're taking a stance that's way too wide here, and what's happening is this back leg is getting a big stretch. When you do it in this fashion, where you're taking a really long stance, you're going to feel a ton of stretch in this back leg, right? So the back leg is working very hard here for stability, but it's also shifting a lot of that stress between legs versus we want most of the stress to be on the front leg. Now, it's not to say that in a normal Bulgarian split squat in any of these variations, both legs are always working. We just want to make sure that we're getting what we're looking for here. So in this example is a compensation to take stress off of that front leg, off of that surgical leg. We're taking an extremely wide stance here, and we're getting at a big stretch in this back leg most likely, which is also going to limit how low you can go in this exercise. Lastly here is what we want a Bulgarian split squat to eventually look like when the goal is to strengthen the quad and the front of the knee after ACL surgery. Okay, so this exists on a continuum. It's not like this is good form, that's bad form, right? But remember, our goal after ACL surgery, after ACL injury, is to make sure we get the front of the knee stronger, make sure we get the surgical quad stronger, right? And this example, this form, is going to make sure that happens to the greatest extent here. So this is what our goal should be to work towards at this point, right? So let's freeze frame it and take a look what's going on here. So this is going to be more of a knee dominant squat. Now let's just break it down like we've been doing. If I drew that vertical line from my kneecap straight to the floor, my knee is well past the front of my toes, right? If I just drop that straight line down, we are well into knees over toes territory here. So that's indication number one that, hey, this could be loading the quads pretty well. Number two, look at my shin angle. It's very far forward. It's inclined forward a significant degree, a very positive shin angle here. We're not really vertical or up and down. So checkbox for indication number two, shin angle looks good. Number three, let's look at my torso position. Relatively speaking, we are pretty upright, right? So we are chest up in this position, and I'm not pitched forward. I'm not dumping forward too much. My stance width is appropriate, right? My foot is not super close to the bench. It's at a comfortable width where I can get into this position well. And most of my weight is over the front leg, right? So you can probably compare and contrast to the previous examples where in some of them, right, where I had a lot of stress on the back leg, this one, my back leg is just helping me stabilize my body mostly, and the front leg is doing all of the work here. Now, not everyone's knee can handle this position depending on where they are in their recovery. There are many variables that can be changed to make this exercise a safe and tolerable starting point for someone. And this is where an ACL specialist can help decide how to appropriately start an exercise and how to progress it to move closer to your goals. So here are some helpful tips to assess this yourself. Number 1, film yourself from the side angle. This way you can check out your form between sets, just like we did here. Number 2, you can perform them with a mirror by your side. This will give you real-time feedback as you're doing the exercise. And number 3, think about keeping 80% of your weight on your front leg the entire time. Yes, even in the bottom position. And number 4, shoving your knee forwards while keeping your chest up can be a good cue to think about. Compensations after ACL surgery are normal, but they have to be addressed. Otherwise, your brain and body will keep finding those shortcuts, wasting precious time and increasing your risk for re-injury if not addressed. If you want me to do a breakdown like this for a different exercise, comment the exercise below. If you found this useful, please like, share, and subscribe. If you're not receiving this level of detail when you're performing your exercises, or maybe you aren't too confident with your current plan, I'm here to help. Click the link in the description and book your free call with me so we can find the bottleneck in your recovery and develop a game plan to come back stronger than before. I'll see you on the next video.